Hello, friends. Welcome to Psychiatry Education Forum Academy's updates. So, we have a new treatment option recently cleared by FDA as an augmentation agent for MDD, and this is called Rejoyn. So this is not a medication. This is a prescription digital therapeutic. So this is like an app. This is an app, not like an app, but this is a prescription form for MDD augmentation. I think this is a very smart step taken by uh, this company who did studies on that. I think this will increase the acceptability, but I will talk about all that in a minute. But friends, I am Dr. Harvinder Singh. I am the creator of Psychiatry Education Forum Academy, and I have no disclosures or financial ties with this company or any other pharmaceutical company for that matter. And I will discuss this treatment option in these sections. So without wasting any time, let's start our discussion for today. So what is Rejoyn indicated for? So first, as I said, this is a prescription digital therapeutic. This is an app, but this will need prescription from your doctor. And this is for the treatment of MDD symptoms only. And this is really important. This is an adjunct to the clinician managed outpatient care. This is not a standalone treatment at this time. And this is for 22-year and older. So adults, not for children and adolescent right now, because it was not studied mainly. That is the reason. And a patient should be on antidepressant medicine. So it's an augmenting agent, as we mentioned, and this is intended to reduce MDD symptoms. So this is an indication for Rejoyn. Now let's briefly discuss what is this product, what will this contain, how to use it. So this product this app will have three major inclusion. So this is a 6 weeks treatment, first of all, which is good. And the first component is CBT based lessons. So they have two things mainly: lessons and exercise. Lessons are the CBT based lesson. CBT stands for cognitive behavioral therapy, as you all know. So this will mainly include these three principles of CBT, which I will talk again in a few minutes. But these are emotion regulation, behavioral activation, and cognitive restructuring. And this will actually take only 3 to 4 minutes of your time when you do it. And the lessons will be available 3 times a week for 6 weeks. And the second component is which makes it unique compared to other treatment option. And this is the EFMT exercises that a patient has to do. And these EFMT stands for Emotional Faces Memory Task. So this will only take 11 to 26 minutes. It's variable depending on the patient. And it's again very similar to CBD based lesson 3 times a week for 6 weeks. So this EFMT is a working memory task that has two components like stimulus and response. So the stimulus is the facial expression of emotion. So there are they will show you like 4 facial emotions. That's the stimulus. And the response is recall of those emotions. And the 4 emotions are happiness, sadness, surprise, and disgust. And then the last component is there will be personalized reminders and messages sent to patient. This will only take less than a minute, and they are given sent regularly throughout the treatment. So this is a basic framework. And how this is delivered is like this. So it's a 6 weeks treatment. I know you can't see that on the lower left side, but the last one is additional 4 weeks of reminders. Like there are 4 weeks additional that you can use this for, but it's mainly a 6 weeks treatment and 4 weeks extra if you need to repeat them. But in first week, every day you will get lessons, which is CBT lessons. This is an example, like here. On Sunday, you're getting CBT lessons, right? Uh, and the next will only unlock at, I think, at midnight. So you can't just jump to the next one quickly. So next day, that exercise will be released and you do that. And this is how it will go. So 2 2 2, and the same pattern continues, and then in the end you can revisit lesson number 1 to 18 at any time for additional 4 weeks, and after that the access is over. That is the framework. But this is interesting. This is a recommended treatment schedule, but it may be difficult for some patients who are busy with work or life to do this every day. So they have also recommended this alternate treatment schedule, like doing 2 lessons together. Like mostly on like Monday, one lesson is available. Tuesday, another lesson, like lesson exercises available. On Wednesday, if they miss, they can do together like this. The goal is to finish lesson 1 to 3 first week, exercise 1 to 3 first week, and so on. So there is a flexibility here, which is good. Now, you will ask, what is the mechanism? This is definitely like a psychotherapy approach, but with unique component attached to it for 6 weeks with antidepressant. But to understand the mechanism of action, we need to first know that individuals who have MDD, which is major depressive disorder, there are 2 features seen in the brain. The number one feature is there is hyperactivation of the limbic neural system, which is mainly involved in emotion perception and response. And the major structure involved with this is amygdala. So that's the hyperactivation of amygdala. And there is hypoactivation of the cortical circuits, cortical system, which are responsible for cognitive control and emotion regulation. And this mainly include the prefrontal cortex, like dorsal prefrontal cortex, ventrolateral and medial prefrontal cortex. And you will see why this is relevant. But see how these like emotion perception, emotion response, cognitive control, and cognitive regulation, that is what that lesson and exercise are targeting. So let me talk more on that. Now, those CBT based lesson that I talked about, there are 3 things, right, in the CBT based lesson that you will learn when you do this. First is cognitive restructuring, which we all know that CBT works on restructuring your cognitive distortion, which are maladaptive cognition. So you identify and reframe it. And these lessons will help you do that. The second thing CBT based lesson will focus on is behavioral activation, which is mainly activating your increasing goal directed behavior, activity, and interpersonal interaction. And the last one is mainly emotional regulation. This is what it stands for: regulating and modulating your emotional responses, reactivity based, and the lessons will help you guide that. So that is what CBT based lessons are. And the EFMT exercise, mainly it's a form of cognitive emotional training, and this is designed mainly to enhance your cognitive control over your emotional information processing. And this works by targeting 2 key areas in the neural network that we just talked about. First is amygdala, right? The hyperactivation one that we saw on the left side in that diagram. So first is amygdala, which is activated when those facial emotions are identified. That was the first stimulus in that EFMT exercise. And the second is dorsolateral prefrontal cortex, which is activated upon recall. which was the second component of EFMT exercise, right? When you recall those emotional stimuli, those 4-1. And this is the diagram that I was referring to. So that is and it appears that EFMT exercises is what makes this app unique compared to the other options available right now. Now, this approval by FDA, I should say clearance by FDA, is based on this Mirai trial. This was actually multi-center, remote, double-blind, randomized controlled trial. And this is a basic design. So for first 3 weeks, they did screening. And there was inclusion criteria, exclusion criteria. I will briefly go over that. But I think this is important to know which were not included and which patients were included so that you can use or recommend this app accordingly. So the inclusion criteria for this trial were MDD was diagnosed using DSM-5 for patients between age group of 22 to 64. And that's why it's currently approved for 22 plus only. And the HAM-D severity was more than 18, so that puts people in moderate to severe depression severity. And patients were on ADT's antidepressant trial. So current antidepressant trial patient had inadequate responses. So that was the inclusion criteria. Let me actually move my, let's see if I can move this. Okay, I'm just moving it up a little bit right now. So exclusion criteria were bipolar or psychotic disorders were excluded. So you don't use it for that. Patients who have PTSD, panic disorder, OCD, substance or alcohol use disorder were excluded. This is interesting. Patients who have inadequate trial to more than one antidepressants were excluded as well. I think they were not looking for treatment-resistant depression, it appears. And also patients who were given MDD augmentation trial, like all the augmenting agents, if they were used, that was excluded. So that again points to the use of or avoiding treatment-resistant depression here. And then that's what treatment refractory MDD was an exclusion criteria, and patients who are at suicide risk were exclusion criteria. So what they did is after, let me move my video below now. Okay, now. So after this, they found 386 participants who were given this app, and they were actually divided into the treatment was for 6 weeks, and they were given equally divided into these two groups. Both groups were on antidepressant. The first group received Rejoyn app and the other received sham app. And sham app was mainly a cognitive training exercise called Shapes Memory Task, but they did not included CBT-based lessons or EFMT exercises, right? Which is what makes Rejoyn unique. And then it was an extension 4 weeks where they were just continued on antidepressants. And there were many endpoints. The primary endpoint was MedRS at 6 weeks, and at 4 weeks, they also looked at other scales, which I will not go into at this time. But basically, this is what they found with MedRS. So you can see the blue one is the Rejoyn. So CT150 is the name they used for this one. And this dotted line is the sham app. So they both were on antidepressants. So response is definitely happening at 2 weeks, 4 weeks, and 6 weeks, right? But you can see, this is the changes in the MedRS. But by week 6, you can see they close to 9. That's a very big drop from moderate to severe to mild or even in remission. So that is this is a statistically significant with p-value of 0.05. So that is how the FDA clearance came into picture. And very briefly, there were no major side effects. It's an app, right? What side effects will you see? But there were some data on safety, suicidality. How many patients developed that? Because patients were also on antidepressants, so we need to be mindful of that when we review this data. But for these two groups, one on regional versus the sham, for treatment, in the treatment phase, 6 weeks, 6 patient in the rejoin group versus 9 in the sham group expressed suicidality. And during the extension of 4 week phase, 1 in rejoin and 2 in sham group did that. So you can see that overall the numbers were less for rejoin. So I will let you make um, your interpretation from that, but that is the only information I was able to find. And looks like they never mentioned anybody needing admission to the hospital or discontinuation from the treatment for due to these. So this is the last thing. It is not available yet, but it should be available later this year. But when this is available, how will you use it? So these are the steps. Number one, this is only intended for people who are proficient in written and spoken English, who have access to their smartphone, and they're familiar with using apps. And healthcare professional will submit a prescription like we do for medication to the designated pharmacy. So pharmacy will be handling this, which is interesting. And then once the prescription is gone, patient needs to download the app, and they can create the account using their phone number and email, and then password will be set up. After that, pharmacy, once everything is verified, pharmacy will send the access code to unlock the treatment, and this code will be provided by the dispensing pharmacy. And once the access code is provided, patient can have access to the treatment. They can start that and follow the instructions on the app. And let me move my video on top again. Sorry. So patient will go through that 6 weeks of treatment, and then there at the end of that, they can still do additional 4 weeks to uh, once to repeat those learning and finish it afterwards. After 4 weeks, they will no longer have access to that. So friends, this was very brief overview of this new app. What are your thoughts about this? This sounds interesting, right? To see how this will play out. But this was a very basic overview. Again, I'm Dr. Harvinder Singh. If you're interested in learning more, and I'm actually talking to our medical professionals. If you're interested in learning more from a medical standpoint, we have so many clinically relevant chapters. Please go to psychiatryeducationforum.com to learn more about our academy membership. But till then, you all take care and bye for now. Thank you.